I'll give it. I know it's a minute or two after 6, but people are still coming in to the Zoom meeting. So I'm going to let a few more people join and then we can start. All right, this looks like we've reached a plateau here. Hello, and welcome to the latest PediaTrust question and answer session, Ask the Pediatrician. Tonight's webinar, welcoming your new baby during a pandemic. My name is Ruben Rakova. I'm the medical director for PediaTrust and your host for tonight's session. Our panel tonight includes Dr. Melissa James, pediatrician at Ad Park Pediatrics with offices in Addison and Oak Park. Debbie Jordan, lactation consultant at PediaTrust. And our special guest tonight, Dr. Brian Sklar, OBGYN from RPW Obstetrics with offices in Elmhurst and Oak Park. Our session tonight will be about an hour long. We're going to try and wrap this up right around 7 o'clock, and it will be recorded. We will be sending out an email to everyone who registered for the event in the coming days with a link to the recording. We've had questions coming in for the last few weeks, and we'll get to as many of those as we can. But those of you watching tonight can also submit questions either through the chat function on the Zoom call or through Facebook Live, and we'll try to get to some of those as well. So let's start with a basic question that many have asked, and that is, how do I keep myself safe from COVID in the hospital during labor and delivery? What are the current rules or restrictions regarding visitors, husbands, grandparents, siblings, etc.? Dr. Sklar, what can you tell us about the COVID safety precautions on L&D at the hospital you work at?
So just about all the employees now have been vaccinated. So they are protected, not just from getting it, but also that reduces transmission also. And so during labor and delivery, all patients who come in labor are actually tested for COVID. And if it's a scheduled induction or a scheduled C-section, then they actually have them come in like a couple of days beforehand or to an outpatient center and get COVID testing with a PCR that's a little bit more accurate. And so that just helps us all plan, and if additional infection control practices are needed, then we can have those in place. As far as the visitor guidelines go, those have been fluctuating as this pandemic has evolved. But with the current numbers and what's going on in the community, we are allowing one partner as well as a doula to be with you during labor and delivery. You are allowed to have another person in the room in addition to that who can come and go. But they want that person to not really be changing out with other people. It's just that one other person. So you can't have up to 3 people in the room currently. And then when you go to the postpartum unit, it's the same. You can have one person in the room and then another person who can come and go, but you can't have more than 2 people at a time in the postpartum room. So that person can change out with somebody else and sign it. And that's our hospital. Each hospital might be a little bit different in how they do things, but I think it's from what we've heard in the community, that seems to be what many hospitals are doing currently.
Thank you. I would agree. Working at a different hospital than Elmhurst, I would say that's pretty par for the course, the ones that I go to. All right. So once the baby is born, what are the suggested visitor guidelines for newborns, both in the hospital and at home? Should they have any visitors? None? And if so, for how long? Dr. James, what advice do you have for them?
So as far as the hospital, like Dr. Sklar said, I can only speak specifically for Elmhurst Hospital. As of right now, they're only allowing mom plus one supporting partner in the room in the postpartum unit. So as of right now in the hospital, it's just mom and one other person. But then when it's time to come home, that's the bigger question, the bigger thing that we have to, we all have to consider. So it's an exciting time. We know that you want your newborn to meet family and friends. But before all of that, we have to consider just a couple of things. So typically what I recommend to my patients are just a couple important facts before allowing visitors in your home. So one of the things that I recommend is keeping your bubble as small as you can, especially in the first 2 months of life, whether that just be grandma and grandpa, or if it's your sister or your brother, whoever's going to be supporting you in the first few months with that newborn, just try to keep the visitors as the smallest group as you can. And if you do allow visitors in the first few months, the things to kind of consider is one, recommending that they're up to date on their vaccines. And those vaccines would include the most recent flu vaccine. The second vaccine that we typically recommend for visitors to have is for whooping cough, or the pertussis vaccine, or the other name that you may hear is the Tdap vaccine that's given to adults. Because for us as adults, the whooping cough is just kind of this lingering cough that's more annoying, that goes on and on and on. But for a newborn, it can be very devastating. So we want to make sure those visitors do have that pertussis vaccine at least 2 weeks prior to visiting. And then another thing to keep in mind, if we do open our doors to that small bubble, is making sure that all of the visitors are completely symptom-free. So not having any signs of a cough, a fever, runny nose, congestion, any other cold-like symptoms. So if they do have any of these symptoms, just kindly ask them to just kind of stay away until they fully recovered. So making sure that one, they're vaccinated, two, that they're staying away if they're sick. And then the other thing is just also, if they are coming over, to making sure that they're washing their hands upon arrival and before holding the baby. And then just an extra layer just to add to all of that is, if you're still a little unsure about that, it's okay to ask them to wear a mask if they are going to be holding the baby, just to have that little bit extra layer of protection. And again, I know it's a lot to ask from these visitors, but you can always blame it on us, your pediatricians. You can say they ordered us, they told us if we do have visitors, it's okay to put the blame on us. We're totally okay with taking that.
That's good advice. Thank you. Debbie, this next question is for you. Let's assume a mother is COVID positive. What are the safety protocols for that mom? Specifically, is breastfeeding still an option for her?
It's absolutely an option. It's oftentimes, it's highly recommended as well as highly supported. I do work at Edward Hospital as well. And in our facility, we do room in with moms who are COVID positive, if they're symptomatic or asymptomatic. And we just follow respiratory contact isolation protocol, which includes the hand washing, the face mask, amongst the family in the room, including the caregiver partner, as well as the patient. That involves wearing a mask, remaining 6 feet apart while you're not feeding, or avoiding unnecessary contact with the infant if possible, if mom is the one who is positive and with symptoms or not. And relying on that caregiver or support person to be that primary caregiver to the infant. In some cases, we have had women who, or infants who will remain in an isolette versus an open crib for additional level of precaution, since there's no recommendation or possibility of infants wearing masks, obviously. So, but in the unstable situation where a woman may need to be separated, which is very rare, in the event that's the case, we do still highly support the breastfeeding and the pumping and initiation of establishment of the milk using a hospital grade pump at Edward Hospital, as well as strong recommendation for follow-up once everybody is in a stable condition in outpatient after everybody has gone home. So it's a continuation of support.
Thank you. I think it bears noting for everybody on the call that the virus itself is not transmitted through the breast milk. It's transmitted like it is in any other person, and that is respiratorily. So the mother breastfeeding the child, obviously very close contact, and it's through her breathing and respirations that she can pass the virus onto the baby. That's why wearing the mask and protecting the baby is really important, but it's not through the breast milk itself.
That is correct.
All right. We've had a lot of questions about vaccines, and I'd like all three of our panelists to answer some of these questions about the vaccine. We'll start with Dr. Sklar. One expectant mom wants to know, what's your opinion on getting a COVID vaccine during pregnancy? And what should pregnant women consider when deciding whether or not to get the vaccine?
Yeah, so this is probably the most common question I'm getting these days. So, we do know that COVID, although the risk is, thankfully the absolute risk is not high, COVID itself during pregnancy poses increased risk. So there's, good data out there that shows that if you get COVID while you're pregnant, you have a greater chance of being hospitalized, you have a greater chance of being on a ventilator, and even a greater chance of dying. Again, that risk is overall low, but it's higher than the general population. So regarding the vaccine is the best way to prevent against getting infected. Obviously using other social distancing, hand washing, not being in large groups, is obviously helpful, but the vaccine itself is going to be your best bet with it. There's not a medical reason why the vaccine should cause any problem to a developing baby, okay, and to the pregnancy. The initial studies were not done in pregnant women, so it is true we don't have like direct data from those studies, but they have started to follow patients who have gotten vaccine, who have gotten vaccinated, who are pregnant. And some of that data is starting to come in. One of the things that was really reassuring to see, pregnancy is an immunosuppressive state. So it's harder sometimes for your body to generate antibodies when you're pregnant. You're more prone to getting sick. But they found that the vaccine works just as well in pregnant patients as outside of pregnant patients. So that was reassuring. But the vaccine itself is out of your body within a few hours to a couple days. And I think it's important for people to understand that it's not getting into your DNA. It's just it's having your body make the spike protein basically so that your body can recognize it and make antibodies to it. So there's not a real medical reason why the vaccine should affect the fetus. It's not a live vaccine. Things such as chickenpox is a live vaccine, and so we can't give that during pregnancy. But this is not a live vaccine, so really there's not a medical basis why we would think it would cause any harm in a pregnancy. And as this data is starting to come in, we have not seen that. The long and the short of it is we know COVID can be, very harmful when you're pregnant. And we don't have a reason to believe that the vaccine is harmful to the pregnancy. And so we're pretty supportive of it. Both the American College of OB-GYNs and the Society of Maternal Fetal Medicine feels that it should be offered to pregnant patients. And then clearly, if you have increased risk factors, it would be even more of a reason to have the vaccine to help decrease those risks. So if you have diabetes, overweight or obese, severe asthma, other respiratory or other health problems that can suppress your immune system and make you more susceptible to the COVID infection, then definitely the benefits outweigh any possible risks with that.
Thank you. And as a follow-up, I've seen online a piece of information floating around out there that the vaccine can affect future fertility. What can you tell us about that, Dr. Sklar?
Yeah, I've been kind of surprised too. I've been seeing, having more questions just recently on this. There is absolutely no like biological reason why this would harm fertility. Again, it's not getting into the nucleus of the cells, so it's not something that will be propagated on. It's just getting your body's machinery to make the antibodies to protect you from getting infected. So there's absolutely no basis for it. It doesn't make really sense from the medical side of things. And I'm not sure where it's coming from, but I've had multiple patients asking about it lately. And it's concerning because it really feeds into the hesitancy to get the vaccine when there's really not a medical or biological reason for it.
And almost a temporal impossibility. We've only been using this vaccine for 5 months. It's kind of hard to say it affects your future fertility when we only have 5 months of experience with it. So, all right. Debbie, this next question is for you. If you're vaccinated while pregnant or breastfeeding, can you transfer COVID antibodies to your baby?
Yes, it's understood that you can transfer antibodies to your baby through the breast milk. As Dr. Sklar had said, that is not a live virus that's being that is being inoculated, but your body will develop antibodies just like any other vaccine that you have received and be transferred through the breast milk. The CDC is, because the fact that they do not have any clinical trials or any data available, they are however, recommending that lactating women be vaccinated as a result of that, those findings.
Oh, it's good to know. Protection for the baby. Okay, and so as a follow-up, do you recommend getting the COVID vaccine while breastfeeding?
I do recommend starting with a conversation with your pediatrician as well as your primary care physician or your OB to discuss the risk factors that you are you as a woman would potentially encounter to help guide you on that decision if you're undecided. But yes, I do, as a lactation consultant and as a nurse, I do recommend the vaccine to lactating women.
Thank you. All right, Dr. James, on the subject of vaccination, one mom wants to know, can grandparents hold my baby if they've been vaccinated for COVID, along with the other ones you mentioned, flu, tetanus, diphtheria, pertussis, et cetera, et cetera? And what can you tell us about how to limit or not limit visitors who have been vaccinated?
So kind of like what I said a little bit earlier, as long as, I think it's fine, as long as you know that grandma and grandpa, one, are up to date on their vaccines, which it sounds like in this case, they've had the flu, Tdap, et cetera, even the COVID vaccine, which is good to know. And then the second thing, also just making sure that they're not having any sort of sick symptoms before coming over. And just another thing to just kind of keep in mind is, just knowing if they're practicing, distancing when they're out, if they're not going out into large gatherings, they're not traveling all over and putting themselves in higher risk situations. But if you know that they're being responsible about, being in this pandemic and avoiding those sort of high risk situations, and they've been vaccinated and they're completely healthy, I would say that's completely okay.
Great, thank you. So we got a question that just came in through the Facebook Live feed, and this one is going to go to Dr. Sklar. It's specifically a question about C-sections. What should a mom expect during a C-section during the pandemic? And how about after the C-section? What should or shouldn't she do?
So I think the care is basically the same, whether it's during COVID or not, as far as how we care for patients. The only difference would, and I can talk about that in more detail, like if there's anything different with, C-section versus vaginal delivery, but specifically regarding COVID, the only thing that would be different is if you tested positive when you came in, and how we would use contact and respiratory isolation precautions. So the stuff that you've seen on TV with the nurses walking into the rooms completely masked and face shield and like an apron gown, plastic kind of gown, double gloved, all sorts of things to prevent transmission to the staff or for them to transmit to any other patients. And during labor, and I guess even during C-sections, they might have you wear like a little isolation mask, the little air looped mask. But if you are in the process of like pushing or in the active phase of labor, not everybody can keep that mask on, and we're very understanding of that. And so I think that that's not a big deal. But if you can keep it on, then they ask you to keep it on. But it doesn't really change how we manage the C-section post-op care, either during the C-section or afterwards. We, the people in the room, the anesthesiologists, the obstetricians, the nurses, the neonatologists, if the patient has tested positive for COVID, then we would all have our additional PPE on, our personal protective equipment on. But other than that, I think from the patient's side, it wouldn't really be any different.
Okay, good to know. Thank you. Debbie, one mom asked, is it safe to get milk from milk banks during a COVID pandemic?
That's a good question. And yes, it is safe to get milk from the milk banks. They are closely monitoring the developments of COVID-19 along with the Department of Public Health, CDC, and the FDA, making sure that they're doing quality processing of the breast milk with a very comprehensive screening and pasteurization of the milk. They learned a lot with the SARS virus, rather recent, and how that high heat in the pasteurization process had eliminated any risk of that virus in the milk. So there has, even prior to any of the pasteurization or the heat, there has been no COVID detected in breast milk, according to the milk banks' recent release of information. But they're following a very diligent standard of practice that is protecting on many layers of safety with the breast milk, especially during this pandemic.
All right, thank you. We got another question that came in on the Facebook Live feed, and this one is for Dr. James. What's the youngest age you would recommend letting your baby go to daycare during the pandemic?
So that could be a little tricky, but I would say kind of the same guidelines that I said earlier. So we know with newborns, their immune system isn't fully ready to be exposed to germs yet. Typically, we say the immune system is functioning a little bit more adequately around the age of 2 to 3 months. And also at the 2-month mark, they get their first handful of vaccines. So I know with everyone's situation, it's a little bit different depending on how much time you get off of work and when you need to put the baby into daycare. But if you can hold off to at least that 2-month or 3-month mark when they've reached after their first set of vaccinations, I think that would be at least the safest. And it wouldn't really change, I'd say, even in a pandemic, because luckily COVID luckily we haven't seen any severe cases affecting these newborns. It's typically if they do get COVID, they're typically asymptomatic or it's a very mild cold. So you may just notice a little bit of a runny nose or some congestion. So luckily in this pandemic, the newborns are in a way having a very mild form or no symptoms at all. But again, I guess even before pre-COVID or even after COVID, I guess slows down a little bit more. I would say try to hold off to at least 2 months until they get that first set of vaccines.
I think that's wise advice. And if I can chime in here, the younger they are, the harder it is for them to get it. Right? At most of these daycare places, the staff is fully vaccinated in most places. I mean, something you should ask about. And if they're, in a large daycare, then they're isolated, right? At 3 and 4 months, they're just with other infants and their cough isn't very productive. They're not crawling all over each other. It's hard for them to actually get COVID from another kid. It would be from a staff member, and most of them are vaccinated. It's later when they're 12, 15 months, they're walking, they're rubbing their noses, they're rubbing snot all over each other, they're sharing spit, all that stuff that happens. Then it's much more likely that they're going to get it. But at the very young age, it's probably unlikely that they would even be exposed to it. So that's some consolation. All right, Dr. Sklar, one mom wants to know what you should do, or what she should do, sorry, leading up to delivery in terms of social distancing. What can you tell her?
Yeah, so, especially for 2 reasons leading up to your delivery date, you really want to kind of, be careful of your bubble and really use all those things that we know work. Social distancing, hand hygiene, wearing a mask, not being in large groups. Because when you do come in, we're going to test you for COVID. And then you don't want to have that additional, issues while you're there. And then secondly is it's towards the end of the pregnancy when the baby, we've already talked about that with pregnancy, your immune system is suppressed, but also your belly's getting bigger and it's pressing up on your lungs, on the lower part of your lungs. So you actually have less lung volume to overcome those respiratory infections and to oxygenate well. So you really want to be careful as you're getting towards the end that you're not exposed, you're not, risking getting infected, for that reason. So really, there's many countries, right? Like Thailand has very little COVID outbreaks, right? Their overall number of deaths is, I think, around 1,000 or under 1,000. And they don't have nearly the capabilities that we have. It's a poorer country. They don't have the vaccine the way that we have. But they wear masks and they are respectful of that and hand hygiene and things like that. So we know those things work. So those are simple, easy things that you can do to really protect yourself as you get close to your due date.
Good to know. The simple things do work. We just got to keep doing them. All right, let's see here. Debbie, one mom wonders, is it possible to pump too much if you have an oversupply? This is obviously not a COVID related question, but a general breastfeeding question. What do you have to tell that mom?
I say yes, there is absolutely a risk of overproduction with overpumping or pumping and doing feeding. You could tell your body to produce milk for more than one baby if you're exclusively nursing and pumping in addition to that. Then yeah, you're at risk for that. A lot of women fear the pumping in the first 2 weeks, which I support. I'm sorry, I do not support pumping in the first 2 weeks unless it's medically necessary, where a bottle is being given electively or medically indicated, or if a mother needs to for comfort in the event that her milk supply is coming in, she's engorged and she needs to relief provide some relief with pumping. So those are the indications you would pump in the first 2 weeks. After that, you would only pump sparingly for milk production and for preparation of returning to work or the bottle introduction. And that does not have to be introduced any sooner than 4 weeks. In the event that the baby is nursing well, you got an adequate milk supply. There's really no indication for pumping outside of those windows. But if in the event you have that concern, overproduction can occur even beyond the frequency of emptying the breast or the efficiency of emptying of the breast. If you have concerns of overproduction or a history of overproduction, I would recommend consulting with the lactation consultant early on for guidance for that first, especially during that first 2 weeks postpartum.
Okay, thank you. This is a very good question for Dr. James. One mother writes, I'm expecting in June, and my toddler will be 3 at that time. A friend of ours will have a 9-month-old at the same time, and they're currently choosing not to vaccinate their child. Now, obviously, this is not COVID vaccines, these are regular vaccines. Is it safe for my newborn to be exposed to that child? And is it safe for my toddler to be around unvaccinated children?
So that's a very good question. So in regards to the newborn, kind of like I said a little bit earlier, again, their immune system doesn't fully develop until usually pediatricians, we use that 2-month mark as kind of a guideline to say at that point, you know, they've received their first set of vaccines. Their immune system starts to function a little bit more adequately. So I would say no, as far as the newborn being around the unvaccinated friend. It's just a higher risk for them, you know, to get any sort of viral or bacterial infection. And it's really hard with the newborns because the only symptom that we see if they do catch something is typically just a fever, especially in the first 2 months of life. So putting them putting them at risk near an vaccinated child is putting them at risk for getting any of these sort of viral or bacterial infections. As far as your 3-year-old, they've received majority of their vaccines at that age. So I would say, your 3-year-old is most likely protected against majority of any of the more serious infections. So that would be okay, but I would try to keep your newborn away, as far as you can.
Thank you. I would agree with all of that. All right. This is a question that I think both of our physicians should answer. One mom wrote, I'm pregnant and I received the COVID vaccine. How will I know if my baby has any antibodies? So I'd like Dr. Sklar to answer first if his hospitals are doing anything about that situation. And then we'll go to Dr. James. Dr. Sklar?
Yeah, so we're not currently testing for antibodies. There's, early on in the pandemic, when people wanted to know if they had been infected, they were doing antibody testing, but they haven't really. There's really not a medical basis for, like, there's not anything that would change our management. We do know that some antibodies can get through to the baby, but there's not really. We don't know like what level is important for the baby to have protection, and so there's not really any way to use that information in any decision making. So I'm not aware of anyone who's testing for antibodies for that.
Thank you, Dr. James.
Yeah, I completely agree with Dr. Sklar. As far as in the hospital, we are not testing the newborns, even in their first, couple visits with us in the office. There's no indication for us to test the newborns. Like he said, it wouldn't change management. So as of right now, there is no antibody testing.
Right. And again, if I can chime in here, it also doesn't necessarily mean anything. I mean, the CDC certainly does not recommend testing for antibodies after a person has received the vaccine, partly because antibodies are really just one arm of your immune system, and you have other ways of fighting vaccine that we can't really easily measure, that T cell counts and differentiation of T cells. So your body may be mounting an immune response, and the antibodies may not necessarily reflect that, but you'd be protected anyway. So it's a bit of a moot point. All right. Here's another non-COVID question for Debbie. How long can frozen milk be stored, and how long can the milk be in the refrigerator before going into the freezer?
All right, good question. Different pieces of literature will tell you slightly different numbers on that. And the variables include the proper storage, the storage use of the freezer, the refrigerator, how old is the equipment that you're using, how frequently used is the equipment. Breast milk is very sensitive to temperature changes. So whether you're using a freezer, a standard freezer, deep freezer, or refrigerator, you want to store the breast milk in the far back compartments. So especially if you have a refrigerator with frequent use and freezer frequent use, you want to be very careful of that. The general guidelines for storage of breast milk would include, I teach parents the rule of fours. It's good at room temperature for 4 hours. It's good in the refrigerator for 4 days, and good in the freezer for 4 months. Deep freeze up to 12 months. But again, those variables would include if you've had power interruptions, equipment malfunctions, things like that. So those numbers can be variable, but on general rule of thumb, 4 hours, 4 days, 4 months, up to 12, and a standard deep freeze with minimal interruption.
That's a long time.
Yes.
Thank you. All right, here's another question for both of our doctors. Does the schedule or frequency of in-office postpartum visits change because of COVID? Dr. James, you go first regarding the baby's visits, and then Dr. Sklar can answer regarding postpartum visits for mom.
Sure. So for our newborns, we haven't changed any of our visits for them. We still see them typically within 1 to 2 days after being discharged from the hospital. And then depending on how the baby's gaining weight and how they're feeding, or if there's any other concerns, we typically just follow them closely and follow the same schedule as we did pre-COVID.
Okay, Dr. Sklar?
Yeah, so we also, we had the same schedule, so we haven't changed that. But one thing we have offered patients is to do telehealth visits. So at certain times during the pregnancy. So if there's times when you're supposed to have an ultrasound or lab work or other tests done, then we would definitely want you to be in the office for those visits. But certain visits, for instance, at if it's 16 weeks or 24 weeks, 30 weeks, 34 weeks, frequently we're not doing testing at those times. And so we found that we can do telehealth, and patients have been very receptive for that, either an audio-visual hookup or just on the phone. And obviously, if you're having any issues or concerns, then we have you come in. But we don't necessarily change our schedule or how we see people.
Okay.
And then postpartum, it's the same thing. We offer, if everything's going fine, you're not having any problems, we can do the telehealth visit. But any other concerns, or if there was, if you had a CSection or any other complication, we would want to see you back.
Thank you. All right, Debbie, here's another non-COVID question. I love this one. One mom writes, if I'm simultaneously feeding both my newborn and 14-month-old, do you have any recommendations to handle the new demand? So first of all, let me say, kudos to you, ma'am. You deserve a trophy and a spa weekend for breastfeeding those two kids. But what advice do you have for her, Debbie, about the increased demand?
Well, definitely kudos are needed for that. And they call that tandem nursing, and it is perfectly fine to tandem nurse a newborn as well as a toddler. I do make the recommendation, though, the proteins within the breast milk in those first 2 weeks, again, are slightly different than what the 14-month-old might need or require. So I would try to reserve that, the initial feedings being allowed to the newborn, and then the dessert to the 14-month-old. I would also use caution too, especially in the newborn stage where women may feel a little uncomfortable with the nursing process as the newborn is learning to deepen the latch. If she's having any sort of breakdown or discomfort, try not to relay that feeling or that emotion so that the 14-month-old is not absorbing that and feeling and developing they could very easily develop a aversion to breastfeeding as a result. So we just try to keep that down as low as possible, as well as if an infant who is having a difficult time nursing, or for whatever reason, late preterm, early term, jaundice, whatever the case is, you have a sleepy newborn, you could utilize your toddler to do some of the work for him or her. So you release simultaneously. So if you have a newborn struggling, you may want to use your toddler to, guide on the other side to help his sibling out. So ordinarily, I would recommend separate in the first 2 weeks, but then they can come together in the time of need or certainly later on.
I guess that's why God gave you two, right?
That's right.
All right. So I'm going to address the comment that came up in the chat on our Zoom call. And that is one mom writes, my pediatrician said she will test my baby for antibodies after she's born since I did receive the vaccine. Do you have anything to comment about that, Dr. James?
So it can be, very dependent on your pediatrician. If they're willing to order that test for your newborn and you're wanting to see if the antibodies are present, that's completely okay. And like we were just saying earlier, the presence of the antibodies, as of right now, we don't really know what to kind of do with that number. We know whether they're there or they're not there. We're not sure how long they last. The amount. So in that case, that's completely fine as long as you and your pediatrician are in agreement with that plan.
Yeah, I would agree. I didn't want to imply that there's, no way, it's forbidden. We shouldn't do that. It was more of is this a regular thing that we do? Usually not, but there's always cases. So yeah, it makes sense on occasion. All right. Let's see, Debbie, are lactation consultant appointments in person or are they virtual still?
For most locations, can be done in person. However, if a family is uncomfortable with that in-person visit, you can do virtual telemed through PediaTrust does offer that. Also, you can do telephone consults to address some concerns and questions. However, the in-person visits are being well managed in terms of the cleaning in between patients. It is strictly a visit between a lactation consultant as well as the infant and the mother. And in the initial visit, we do recommend the support person being present too. And it is a fully masked and protected hand washing environment. So yes, I would recommend that.
And, if I can put in a shameless plug for PediaTrust and what they're doing, since the pandemic began, we've been really doing all we can to keep our offices as safe and as healthy as possible. Many of our offices have either separate entrances, one for sick, one for well, separate times, sick in the morning, well in the afternoon, or vice versa, using only these rooms for sick, these rooms for well, if possible, a dedicated room for a lactation consultant. So you keep the babies away from, anybody. All the thorough cleaning. We have HEPA filters in all of our offices. All kinds of precautions are being taken, as I'm sure they are at RPW Obstetrics as well. So, we've been doing this for 14 months now, and we feel pretty confident that our offices are safe. Okay, this question is for Dr. Sklar. It was, you sort of touched on it earlier, but I want to go back to it because I've had parents ask this question specifically, and that is some mothers are a little anxious about getting tested for COVID during the days before or even during labor in that immediate time in the hospital, because they're worried that if they're positive, someone will quote unquote take their baby away. And I just want you to address that concern. What actually happens when a mom is positive?
Yeah, so, outside of us just being, I mean, it's so important for the staff to know so that they can all protect themselves and then protect their loved ones also, obviously. But we don't separate mom and baby, other than for the usual, like if the baby needs to be in a special care nursery for medical care. So just by being COVID positive, that doesn't, there was a time when they were talking about that and either rooming together as a unit, because obviously when you're in the hospital, it's one thing, but when you go home, your setup might be that you have to be around that baby and you can't have a different care partner just taking care of the baby. So we kind of let them care for the baby as a unit. And so we're not separating the baby from there. So you shouldn't feel concerned about that, and just understand the testing is really to protect everybody.
Thank you for that clarification. All right, this next question shows how much this pandemic affects all aspects of our lives. It's a common question with a new twist, as one mom asks, how do I help an older sibling adjust to a new baby? The older child is not interacting with others due to the pandemic, so I'm worried about the transition. The sibling will be 2 years old when the baby arrives. Dr. James, does this mom do anything different from what mothers have been doing for years when a new baby comes into the home with a toddler?
That's a great question. And we've been getting that question a lot from expectant mothers. So it's going to be the same thing as prior to the pandemic. Being a 2-year-old and having a new sibling come into the house, it's a big change in their life. They're used to being the center of attention, and having that sibling come into the house just kind of ruined their entire world. So some 2-year-olds can be very affectionate and, they adjust really quickly. And then there's other 2-year-olds where, they're the complete opposite. So what I usually recommend for parents is, try to, either tell a story or grab a book that, has a baby and the baby's coming home, or buying a baby doll and, talking about the baby and talking about, a new baby coming to the house, just to better prepare them. And then just another thing to keep in mind when baby does come home, if the 2-year-old is, wanting to be around the baby, grab the baby, touch the baby. We know 2-year-olds are typically all over everything. So making sure you have your full attention on the 2-year-old to make sure they're not crawling or, going to do anything else to the baby. So I think just, talking to them, reading to them, buying a doll, trying to prepare them before the baby comes is an important thing to remember.
Thank you. All right, Debbie, this is a non-COVID question again. For those who may not be aware, what can you tell our audience members about the benefits of breastfeeding in terms of disease prevention in general, not just specific to COVID?
Well, in general, the benefits of breastfeeding are, we can go on forever on that one, but for both baby and for mom, actually, there's a lot of immuno properties that are being transferred through the breast milk to the baby. There are proteins and fats that are not even able to be replicated by the formula companies, that they actually use breast milk to create formula based on the properties of breast milk, which they do their best to come close, but they don't come even remotely close to that. Women themselves can have a decreased response to postpartum depression with breastfeeding, increased bonding, decrease incidences of known breast cancer and other illnesses, diabetes down the road, certain cancers. So there's multiple benefits that can be earned to both moms and to the babies. It's not always an easy process because there's so many moving parts to the dyad of breastfeeding. However, utilizing your lactation consultants in the hospitals, outside the hospitals, either by phone, in person, to guide you through those potential challenges that you might encounter. But it's a wonderful thing. It doesn't have to be breastfeeding. It could be pumping and providing of breast milk to the infant. Breast milk in any way, shape, or form is in any amounts, in fact, is highly beneficial for both moms and babies.
Right. Lots of great disease prevention, the antibodies that are passed. And two other things you didn't mention that I will. One is obviously the cost, right?
Yeah.
Normally gets expensive, breast milk
Yes.
to eat, and weight loss. Every ounce of breast milk is 20 calories leaving the mom's body. So there's something else to consider.
Absolutely.
All right.
Yeah, I would even throw in it decreases bleeding afterwards too.
Absolutely.
Look at, we keep going. Melissa, do you want to jump in? Anything? All right. So obviously most of the audience is made up of expectant moms, but this is a question that has come up for those who just may be contemplating it. And it's obviously directed at Dr. Sklar. During the pandemic, is it even safe to consider getting pregnant? What do you tell those moms, Dr. Sklar?
You know, I do think early on there was a lot of concern. We didn't necessarily, we didn't know anything about this disease and its impact on pregnancy or, younger patients. And, there's been a lot of information in a short amount of time. It's really the first, worldwide infection in the internet age, right? So even in like April, I think there was of last year, there was 700 articles published. And so all this information, so we didn't really know much about it. And I think the numbers bore out that people were concerned because while people were thinking there was going to be a COVID bump because people were home more, there's actually a drop in the birth rate overall. And, because of that concern, luckily, and you guys would be able to speak to this more, but, newborns don't seem to be as likely to be, affected by it. Compared to some other infections out there. And while there is an increased risk in pregnancy of all those problems that I talked about hospitalization and intubation and dying, luckily those numbers are still relatively low. And so we don't like to have increased risk, but I think overall the risk is not that high that if you wanted to, start your family or continue your family and grow your family, I don't think that this would be a reason to necessarily stop it at this point. If you asked me that back last April, I might have had a different answer, but I think we know a lot more now.
We do. And obviously a much more hopeful future with so many people getting vaccinated now and in the coming months, and possibly the vaccine lower age being reduced to 12, which is probably going to happen in the next month. Even more people. So we're getting closer to what we would consider quote unquote normal, or, what it was like before the pandemic. And, it's still, it looks very hopeful. All right, Dr. James, this is a question from one mom. I'm not sure exactly how you're going to answer this. She asked, at what stage is a baby's immune system developed enough to be able to fight COVID?
So I guess in regards to COVID, we don't have the exact answer, but kind of what I mentioned before, in general, like the immune system for a newborn typically doesn't function all the way until usually 2 to 3 months, is what we say against other bacterial and viral illnesses. So I can't give you an exact answer for COVID, but I would assume, lumping it in with all the other infections that we usually say, the 2-month mark, I would say, just, to make it all viral and bacterial infections.
That sounds pretty good. All right. If we're gonna wrap this up right about now, it's getting close to 7, and there's no other questions from any of the attendees online, or then I want to say thank you to our panelists, Dr. Sklar, Dr. James, Debbie, Jordan, and a reminder that again, simple things really are very effective. Wear the mask, wash your hands, social distancing, things you've been hearing about for the last 14 months really do make a difference. And to reiterate, safe to breastfeed. Dr. Sklar and others think it's safe to get the vaccine if you're breastfeeding or pregnant. And the vaccines we know are safe. Certainly there's been a pause on the J&J vaccine, but people are looking into that. And hopefully we'll have some more information, when it becomes available in the next week or two. But I want to wish everybody a healthy pregnancy, and we'll be sending out a link through email to the recorded session for tonight's event. And if you have any other questions, obviously, you can send them our way or talk to Dr. Sklar, and we'd be happy to help. All right, if there's no other questions, everybody have a good night.
You as
Thank you.
well.
Goodbye.
Thank you.